We also showed that the persecution of people that chose to actually stand in their own sovereignty and say, I'm not prepared to take an untested, vaccination without really any data behind it to understand what the impact of it is.
You're here with the vaccine control group. Would you tell us a little bit about yourself, your background? And
Yeah, sure. So I'm really a sort of computer nerd, a sort of computer programmer, data specialist, really. My whole career has been sort of solving problems with data and solving problems on the computer. And we had a little group during lockdown with us in Eastbourne, where we live, talking about how we were not going to get vaccinated, and we used to joke about us being the control group, and it was a bit of a meme. And one day my wife actually in one of the meetings turned around to me, she said, well, could we create a control group? Could we actually do this? And I said, well, we can, but if we're going to do it, I'm not doing it for 6 people in Eastbourne or whatever. It's data to be meaningful, it's got to be in volume. So I said, if we do it, and if I'm going to put all the effort in to do that, it's got to be worldwide. It's the only way it will work. And that's really where it was born. And 2 years later, we've got 340,000 people. We're now working with the World Council for Health. They've been fantastic, because one of the big things with the unvaccinated is they were so persecuted during lockdown. And the people were attacked, losing their jobs. Their livelihoods were under threat. They couldn't see family members that were ill in hospital or in care homes. So we created this ID card, which we used, which many people used, that said must not be vaccinated. And so many people, so many success stories of people using that and taking it along to get access to care homes, to get access to work, to keep permits. With the World Council for Health now, we've got a new certificate of participation with our study. And that's really what we're doing, is we're studying the health outcomes of the unvaccinated, or that's what we started off doing. But it's 2 years in now, and I feel like we're really just getting started. We're really now starting to understand what the bigger vision is moving forward, and how we can really use this data to change healthcare for better. People have got to start taking responsibility for themselves and for their own healthcare. And it's about the self, because you can't look after somebody else if you can't look after yourself. And so that whole sovereignty message is exactly in line with what we're trying to do. We want people to be responsible for their own healthcare and for their own data. And so we want you to own your own health record, so that you know that you can take that anywhere you want. You know everything about your own health information, and you choose who has access to that information. So you can choose to say, I'm going to go and see a naturopath, I'm going to go and see a chiropractor. And they don't have to be, like in the UK, they don't have to be part of the NHS. You can share that information with them if you choose to, so that you can. And yesterday I had a really fascinating conversation with Pierre Corey, and we were talking about, what this vision is moving forward. And part of our vision is we're going to create a community-derived health database with all the health data anonymized, so that we protect the identity of everybody, but we leverage the information and the knowledge in that data set, so that doctors can actually see what ailments people are suffering from, and what treatments they're taking, and which treatments are having success, which treatments aren't having success. And Pierre said to me, he said, so if I put all my patient data in there, can I then cut and slice that data, and could I analyze it? And I said, Pierre, not only can you analyze your data, you can compare it with other doctors and what's happening in other countries around the world, and see what treatments, what protocols are working, which is having the most success, and we can give everybody that knowledge.
It's so fascinating what you're talking about. I think this leads to kind of innovation in the way how we approach healthcare on an individual basis. But again, in terms of the kind of environment we're in here right now, where there's a lot of concerns around privacy of data, sovereignty of data, control of that data, and quality data in the wrong hands, what that could lead to. How are you dealing with those issues when it comes to medical data? Because understandably, now people because of what you were doing with the vaccine control group. People didn't want their information handed to the NHS because that could be used in ways that prevent them to have access to society, as we saw through the mandates. How are you tackling that part of the problem in putting the emphasis of the data in the user's hands?
That's a really good question. And there is trust. There always has to be an element in trust. And I think the thing people are starting to understand is that their data is in the hands of organizations of massive conglomerates now, where they're sharing their information behind the scenes and nobody knows how their information is actually being used. So what we want is giving people access to this data. We've set this up as a cooperative enterprise, and it's owned by the people. And that's the idea. It's your data, you own it, or it's our data. It's a collective set of data. It comes back to sort of the dreaded QR code, but I'll talk about that in a little bit.
Yes.
But what we actually do is we then report back to you all of the scans of your QR code, so you can see who's using your data. So when you share that data with somebody, you can see if they actually used it or not, and you can turn that off at any time you want. So if I lost my card, I can turn it off and say, right, shut that down so nobody can use that anymore, and I want a new QR code, a new card, and then I can move forward with that. So whenever you share your data, we report back to you how that data is actually being utilised.
And you mentioned the use case of, say, someone like Dr. Pierre Corey, who's obviously been heavily involved in early interventions and treatments, being able to not only access his own patient data, but a wider data set. Would the individual's data be therefore anonymized or randomized, so that if you are, if Pierre's looking at, say, another of the doctors here, the data of another practitioner, would that be of a broader anonymized, without getting too technical for the...
Yep. No, the idea is, so what I have this vision of is having this analytical data set, which is, there's two sides to it. So one side of it is to have dashboards and information available to our community, which is less scientific in nature, easier to navigate, but very informative. So we can put that knowledge in the hands of our community.
Yes.
And then for the doctors, we'll have a much deeper diving platform where they can do true data science on that platform to interrogate it and find information. But it's not the patient that they see. It's the information about the ailments and the treatments and the medications, the supplements, and the outcomes of those that the doctors will have access to. So it's not, the thing that we work really hard to do is to separate the identity from the health record. So technically we use and this is it's been quite costly and it's very complicated as how we've set it up, and we try not to discuss it too much in terms of actually keeping the security of the data there.
Yes.
But we basically are using lots of different data repositories to hold different aspects of the information. So, and all of that is encrypted on disk. It's encrypted during transfer. So we work really hard to have a massive separation between any identity information that we have and the health.
Yeah, I think it's quite a technical question. I understand in the environment we're in, people are still interested in that aspect of it now more than ever. But what I'm now curious about is, what are some of the key things that you've been able to learn so far from that initial data set? You said you had over 300,000 participants, part of the vaccine control group. And I know you've published some of that in reports with support from some of the network within the World Council for Health. What are some of the early indications that you've been able to garner?
So we had our first paper published in, I can't remember the exact name, but I think it's the International Journal of Vaccines and Research, something like that. So
yes,
please, I got that wrong.
We'll put the link.
But that was published. The lead author on that was Robert Vergerg.
Yes.
And there was some really telling information that came out of it. We were able to demonstrate through the paper that the unvaccinated were not the burden on the healthcare system that we were portrayed to be. We were portrayed as being the enemy of the state, and irresponsible. But all we were actually doing was looking after our own health. It also showed that so many of our community were taking proactive steps to manage their own health. So many people were taking vitamin D in large quantities, have taken vitamin C, quercetin, zinc, NAC, and we have that information, so we can see that they are proactively looking after health. They're not individuals that are dumb and ignorant in the way that we were perhaps portrayed to be. We also showed that the persecution of people that chose to actually stand in their own sovereignty and say, I'm not prepared to take an untested, vaccination without really any data behind it to understand what the impact of it is. So, and interestingly, only 5% of our community had never been vaccinated. So 95% of the people that joined us had had previous vaccinations. Mm. So they weren't anti-vaxxers as weird. Yeah. They were just critical thinkers.
Right.
And I think that's the big difference. But this data also showed people, the number of people that lost jobs, the mental health issues that people were going through. It was just, it's mind-blowing when you look at what, as a society and as a media, we've actually done to push the fear and to really discriminate against a subset of our society that are family and friends.
Yes. I think what's fascinating about that, not only are you collecting the medical and scientific data, but also the socio-economic and in some ways political impact of health.
Yes.
And the consequences of political decisions through healthcare. Yes. But what fascinates me most about what you're saying, particularly in the context of the longer-term prognosis of what you're looking to do, the longer-term vision, is that you mentioned the different supplements and health steps that people are taking over time. I'm sure you'll be able to see which of those are having the greatest impact. You'll be able to digest and see which are most effective in prevention and treatment.
Yes. And we'll be able to put that information in the hands of the people so they can make informed decisions. Here's all the knowledge. Go and interrogate it yourself. Where is the open data for health that you or I can go and have access to really understand how to look after ourselves better, what supplements we should actually be taking, what really has a benefit? And that can vary from country to country. And also there's other aspects of this, of having access to this health information, that really was driven home to me recently by the train crash in Ohio. And when you look at the pollution that was produced through that, and the long-term impacts of that pollution going into the waterways and into the land and the soil in that community, and now I'm looking at it and going, well, we will be able to measure that.
Yes.
When we have, as we get more and more people on board, we will have that information. And when we do have these disasters that appear, we can truly actually measure that and say, here is the direct impact that you can see at a localized, at a regional level, at a national level. We can truly understand what's happening, and in such a way that everybody can understand. This is a social project.
Yes,
it's not a, it's not a commercial project. This is really a sort of humanitarian endeavor, if you like.
Indeed, it's an incredible project, and the scale of which, the possibilities are endless. It's an infinite possibility, but in many ways, it sounds pioneering, but actually, you're doing the work that should have been done in the first place, particularly around initial control group. And you've mentioned another situation, the Ohio situation with the pollution. This, to me, seems like common sense approach to tackling public health issues.
Why doesn't it exist already? I know. I mean, the first thing I did when lockdown happened, the first thing I did when I started to have questions and I was starting to wonder why and what was happening, I went to the ONS data in the UK, downloaded the information and looked at the data and stripped out the noise from it and said, right, what are the excess deaths? And for the first sort of 12 weeks of 2020, it was flat. There were increased deaths, but it was flat. There was no spike. And looking at that data, as soon as we had government intervention, as soon as we had policy change, the spike in deaths increased. And it was dramatic. And that for me was like, whoa, hang on a minute. We need to get to the bottom of that, and we need to understand what's happening in the data. And where is that information? And that kind of, that drove all of that forward.
Yeah, so I think within that, you can quite clearly see the void. And I think there's almost a historical expectation, which is part of the wider root cause problems, I think, that there's almost an expectation that the government or the public healthcare system will take on the role of the things that you're doing. But I think that expectation has actually led to some of the problems that we're facing. And it's fascinating to hear how now people are rising to the challenge, if you will, and seeing the gaps and the opportunities that have been left by the institutions that have failed us. And again, I think that's one of the strongest messages that's coming from this conference, is that we have to be the change we want to see. And the work that you're doing is really doing that. It's really looking at where we should be doing the scientific process, but beyond that, looking at some of the wider ramifications as well.
It's the sovereignty of your own information.
Yes.
And also there is a change in mindset that goes on, that you have to understand that, because I see a bit of pushback against technology that's happening here. We're talking about, how do we push back against AI? How do we push back against the use of technology and the use of the QR code? One of my hobbies was judo. And, in that art, what you actually do is you use the strength of these things against themselves.
Yes.
And it's not that they're bad, it's that you have to channel that in a way that it works for you. So, one of the ways that we're doing this is with the new health card. And the idea with this is that we're putting your information in your hands and this is what we call an in case of emergency card. So the idea with this is that you keep it in your wallet, in your phone, and then if you have an accident and you're unable to communicate with a paramedic, they go through your belongings to find out who you are. They see this and go, oh, okay, and scan that QR code. And that gives you important information that says, here's my emergency contact. So here's who to contact. Here's my blood type. Here's my advanced decisions. So if you want to stand in your sovereignty, you can say, look, I'm only happy to accept blood donations from a trusted blood donor of the same group that I know where that blood's actually coming from, and that it's somebody that looks after their health, and it's not anonymized.
Yes.
So we want to change and challenge how healthcare is actually done and put it back in our hands to take responsibility. And the same with, I also want, with this information, it's about us choosing. So we choose what information we're going to share that would be available to a paramedic that's attending us, so they can say, oh gosh, he's suffering from this condition. It's somebody that has heart issues already. So it helps the paramedic guide how he's actually going to treat that person when this happens. And I don't know about you, but physically with my own eyes, I've seen more people collapsing on the side of the road recently and in the town centre than I've ever seen before. And maybe that's just because I'm a lot more aware of it now and it's on my radar, but it certainly seems to be that and when we look at the excess deaths that are happening, why is no one talking about that? What is the root cause behind that? How do we get to the bottom of that? And it's through data.
Yes. Des, this is a fascinating conversation. I'm so excited for what you're doing. And I think the inspiration I take from this is that there are people like yourselves in the group, the Vaccine Control Group, and so many people here at the conference looking for solutions, and what you've outlined is part of that solution. And I hope that your work, your message inspires others who are looking at the problems, the people who have the ideas, the knowledge and skills to be able to embrace this and say, actually, we do need a better way, and that the solutions are available to us. And I commend you and the whole team for what you're doing. And it's been a pleasure speaking with you here at the conference.
Thank you for your time. No, I really appreciate it. And it's about all of us. It's not any one individual. We only move forward when we come together. And that's the important thing with conferences like this.
Couldn't agree more. Thank you so much.
Brilliant.
Great
Thank
to see you.